It's Emergency Nurses Week, and I don't want to be politically incorrect, but I want to tell you what I really think about ER nurses. With a story. The story goes back to 1991. I'm an intern in a rural hospital in the middle of nowhere. In comes a gentleman in his late 30s, chest pain. I start getting a history, and then he has a cardiac arrest. And the nurse turns to me and said, "What are you going to do?" And I'm like, "I don't know what to do." I froze. I was unsure. And she said, "You have to defibrillate the patient." I'm like, "I don't know how to do that. I'm an intern. It's like week 2. And so she grabbed the defibrillator and she said, "Hold this paddle here." And she put it on the man's chest. And she said, "Hold this paddle and put it there." And then she said, "Push these buttons." As a nurse in Australia at the time, I'm not allowed to do this. But this is how you do it, and do it right now. And she turned the little knob up, the 200 or whatever it was at the time, and I pushed the buttons, boom! And guess what? It worked. It's such a thing in my memory because I have since then defibrillated hundreds of people and it never worked. This nurse saved that man's life. She wasn't allowed to perform that procedure that was life-saving. Things have changed, but I can't tell you that's just one of 1,000 stories of where the nurse saved my ass. Thank you. Thank you for what you do. What you do really matters. Have a great week.